That beautiful introduction every time we do it, Dawn. That was so nice. Yeah, we just want to thank you for being here. I am Maureen will be the speaker predominantly, and if anything comes up, I am more than happy to chime in, and we can address questions later towards the end. We are expecting a pretty good sized group, and those folks will be joining us, as they choose to, as they are coming in. So I will be muted in terms of my audio, but Maureen, I will have my video on so you don't feel like you're talking to a void. And then you can just let me know, like we've done before, when you want me to move to the next slide. And we did test audio and visual, Maureen, so we're good to go there. Would you like to say anything else about you, Maureen?
No, well, thank you. My name, as Charlotte indicated, my name is Maureen Miletus, and I've been a volunteer with the Alzheimer's Association for the past 10 years in various different roles. And I look forward tonight to presenting the 10 warning signs of Alzheimer's with you. So tonight this is a high level of our learning objectives for the night are. Tonight, we're going to describe the typical age-related memory, thinking, or behavioral changes. We'll discuss the tips for approaching someone who has some memory concerns. We'll recognize some of the common warning signs of Alzheimer's and dementia. We'll identify possible tests and assessments to get a true diagnostic process. We'll name some resources available through the association, and we'll explain the importance of early detection and the benefits of a true diagnosis. I'm going to introduce you to the Garcias. So Mary is a 73-year-old widow who lives alone. She's a retired teacher who has always meticulously cared for her home. And her daughter Lydia has recently been noticing her laundry piling up, her junk mail all over the counter, and old newspapers lying around the house. So this is an interaction between some of the Garcia children back and forth. You know, they're worried about mom. She keeps losing things and the house is a mess. One of her other children just says, oh, that's typical. That's normal, forgetful with age. Another child says, no, that's not like mom at all. You know, do we need to be worried? And then they decide they're going to reach out to their doctor, Dr. Salloway.
As we get older, cognitive problems become more noticeable for almost everybody, and it can vary from person to person. Typically with age, people have trouble coming up with the word they want right when they want it. They have trouble remembering names, and they don't think quite as quickly. What's more concerning, or what might be the beginning of a memory problem, is people have a lot of trouble coming up with words or names, and it's happening more frequently, and the words or names don't necessarily come to them later. And then they start misplacing things, but not just once in a while, because we all misplace things, but more often. And it begins to interfere day to day. That should be a warning sign for people that this might be the beginning of a memory problem.
Dementia is an umbrella term for an individual's changes in memory, thinking.
Sorry, Maureen. Go ahead. Do you want to do the intro for that?
Oh, so no, that's okay. So this is the 10 warning signs of Alzheimer's, and we will hear from a few guest speakers that will identify for you what is dementia, what is Alzheimer's disease, and why it's important to know the signs.
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow and the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual, but there is also some overlap in behaviors among the types of dementia.
More than 100 years ago, Dr. Alice Alzheimer's described specific changes in the brain, what we call the formation of plaques and tangles. Now, Alzheimer's is a progressive brain disease that's marked by these key changes and is thought to impact memory, thinking, and behavior. The brain has three main parts: the cerebrum, the cerebellum, and the brainstem. Each one plays a role in how the body functions. The cerebrum fills up most of your skull. It is part of the brain most involved in remembering, problem solving, thinking, and even feelings. There are about 100 billion nerve cells or neurons throughout the brain that transmit messages in order for us to create memories, feelings, and thoughts. Alzheimer's disease causes nerve cells to die, which leads to the brain tissue loss, or what we call shrinkage, and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's disease, such as memory loss, problems with thinking, planning, behavioral issues, and even at the end stages, problems with swallowing.
It's important to know what the warning signs of Alzheimer's are and to be on the lookout. We know that we change over time, and the warning signs of Alzheimer's can be warning signs of a number of things. But when you see those in yourself or in someone you care about, it's important to check it out, to consult with a doctor, to find out what you're dealing with.
So these are the 10 warning signs of Alzheimer's. It's almost like a jigsaw puzzle. 1 is memory loss that disrupts the daily life. 2, challenges in planning or solving problems. 3, difficulty completing familiar tasks. Confusion with time or place. Trouble understanding visual images and relationships. New problems with words and speaking or writing. Misplacing things and losing the ability to retrace steps. Decreased or poor judgment. Withdrawal from work or social activities. Changes in mood and personality. So again, the family is texting back and forth. And they're talking about the 10 warning signs we just presented to you.
Memory is not all or none, especially when there are early symptoms or signs. So on a good day, people might function very well and not really even, no one notices there's a memory problem. But on other days, especially if they're tired, then things become more noticeable. So memory is variable. It's not all or none. And then there are different type of symptoms that develop for each person. So some people may have trouble with language, may have trouble with organizing themselves, may have trouble navigating while driving, and other people don't have the same symptoms. So you don't have to have every symptom of Alzheimer's to be concerned. And I think the most important thing is determining what has changed from that person's normal level of functioning. And usually people have a pretty keen sense of, what they can normally do well. And then when either they or the family notice that there has been some change from that usual pattern of functioning, that should be a warning sign to people, but they don't have to check off all the boxes.
So I just want to go back a slide or two, Melissa, because I think we should go back to the jigsaw puzzle of the 10 warning signs. And let's talk a little further in one on memory loss that disrupts daily life. This is one of the most common signs of Alzheimer's and forgetting recently learned information. Others include forgetting important dates or events, asking the same question over and over, and then increasingly relying on memory aids, whether they're notes or family members for tasks formerly managed with no problem. What's a typical age-related change, you may be asking? Sometimes just forgetting names or appointments, but remembering them later on in the day. Number 2, changes in planning or solving problems. Some of your loved ones may experience changes in the ability to develop and follow a plan or work with numbers, which may result in trouble following a family recipe or keeping track of their monthly bills. Some of you may find out later that, your parents or a loved one forgot to pay a utility bill or their rent. They have difficulty concentrating and taken much longer to complete a task that was very simple previously. So what's a typical age-related change? Making occasional errors when managing finances or household bills. So now we're going to listen to John and his experience.
I was probably spending 4 to 5 times more time preparing for something than I did, say, 5 or 10 years ago, because of I would lose my thought, I'd lose my focus, I'd get anxious, I wouldn't get to sleep. I was thinking this, I was in my sleep, I was thinking about what I was anxious about, which was I was trying to remember, which was I was trying to prepare, which I was trying to do. So it was really a vicious circle of, so I was able to control it a lot, so that people wouldn't see things and there weren't things to be seen. It's what was disturbing me was what effort I had to put into to do the things I used to do more easily.
Difficulty completing familiar tasks, as we discussed, and it seems to be kind of repetitive. A lot of the tasks are similar in the 10 warning signs. So this one is very basic. This is someone who may get in a car and forget how to drive to a family location or even back to their house after going to a grocery store, even organizing a grocery list, remembering the rules of a favorite game they may be playing. And again, occasionally a typical age-related change is just occasionally needing help to use the settings on a microwave or to record a television show. Now we're going to hear from one of our experts.
Some people have difficulty with math or with reading in a way that's unusual to them. And once again, this is a change in that person. So for example, we all know somebody who was never able to balance their checkbook, right? So that wouldn't be a warning sign for them. But if somebody who always balanced their checkbook to the penny suddenly was paying bills, the same bill over and over, and not able to balance their finances, well, that would be a sign for them.
Four, confusion with time or place. People living with Alzheimer's or other dementias can lose track of dates, seasons, and the passage of time. They may have trouble understanding something if it's not happening right at that moment, or they forget where they are and how they got there. So what's a typical related age change? Getting confused about the day of the week, but you're figuring it out later. Trouble understanding visual images and relationships. For some people, having vision problems is a sign of dementia, which may lead to difficulty with balance, trouble reading, problems judging distance and determining color of contrast, which may cause issues with driving. So what's a typical age-related change? Vision changes related to cataracts. And now we'll hear from one of our other experts.
Alzheimer's disease is not just a disease of memory. It can affect other things too. It can affect the way that we perceive what we see. So sometimes somebody in the early stages of Alzheimer's might go to the eye doctor because they're having trouble seeing. And in fact, their vision is just fine, but the way they're perceiving what they're seeing may be difficult.
Trouble understanding, new problems with words or speaking or writing. We're learning people with Alzheimer's may have trouble following or joining a conversation. They'll just stop in the middle of a conversation and have no idea how to continue on with what they were talking about. Repeat themselves. That's probably one of the most symptoms that we hear about. Struggle with vocabulary, and they have trouble naming a familiar object or just using the wrong name altogether. What's a typical age-related change? Sometimes having trouble finding just the right word. So now we're going to hear from Phil.
The other thing that I've increasingly been struggling with are words, which I've dealt with words my entire life, you know, as an avid reader, as a reporter, as a writer. I struggle with them now.
There we go. Misplacing things and losing the ability to retrace steps. Someone living with Alzheimer's may put things in an unusual place. He or she may lose things and not be able to go back over their steps to find them, or accuse others of stealing, which may occur frequently over time. What's a typical age-related change? Just misplacing things from time to time, but being able to retrace your steps to find them. So now we'll hear from one of our experts.
So some people wonder if, if they lose their keys or their glasses or their purse, is that a sign of Alzheimer's? And one thing that I would say about that is for most of us, we might misplace something, but then if we retrace our steps, we can usually find it. We can usually remember. For a person with Alzheimer's, sometimes they're not able to retrace their steps. Sometimes that memory is just gone. And so when they do find their keys next to the phone because they got interrupted by a phone call when they were coming in, they set their keys down in an unusual space. So there they are next to the phone. If that happened to you or me, we'd probably remember, oh yeah, the phone was ringing when I came in the door. I put down my keys. The person with Alzheimer's might not remember. They might wonder who's moving their keys around because they never put their keys by the phone. So that's just a little bit of a difference in some of the dynamics with losing things in Alzheimer's.
Decreased or poor judgment. People with Alzheimer's may experience change in judgment or decision-making. They use poor judgment with dealing with money. They pay less attention to grooming or keeping themselves clean. And what's a typical age-related change? Making a bad decision or mistake once in a while, like neglecting to change the oil in the car. Now we'll hear from Teresa.
The way I kept my house, I wouldn't say I was OCD, but pretty close to it. And all of a sudden, everything was okay with me. It's like, oh, it's a pile, I'm tired. So my dining room table usually looked like it was someone's office because I always would say I would do it tomorrow. And then my bedroom, as far as clothing, I would just put it in a corner, put it in a chair. And all of this is just, I wouldn't say it looked like I was a pet wreck, but really I was, because I never threw anything away. I always would say, I'll get to it, but I never did get to it. So just the way of my standard of living, it was actually decreasing.
Withdrawal from work or social activities. A person living with dementia may experience changes in the ability to hold or follow a conversation. As a result, they withdraw. They withdraw from hobbies, social activities, or other engagements. They never want to leave the house, having trouble keeping up with a favorite team or activity. What's a typical age-related change? Sometimes feeling uninterested in family or social engagements.
Would you like me to play the video, Maureen?
Oh yeah, go ahead. I'm sorry. I thought you were ahead.
No worries.
One of the most common changes and early on is the person's comfort zone shrinks a little bit, and then that gets worse throughout the course of the illness. So they're less comfortable going out, they're less motivated to do things than they were in the past. So there's some change in day-to-day functioning that way. I think people also lose confidence in their cognitive abilities because they may not recognize someone or know their name or find the right word, and they'll feel awkward, and they don't want people to notice that, so they feel more comfortable at home or in situations with family where they're very, very comfortable with that wouldn't concern them. So people tend to withdraw a little bit and be less outgoing. That's can be one of the early signs of Alzheimer's.
And changes in mood and personality. People living with dementia may experience mood and personality changes. They usually become confused, depressed, suspicious, fearful, or anxious, getting easily upset at home with friends or when they're out of their comfort zone. What's a typical age-related change? Developing very specific ways of doing things and becoming irritable when a routine is disrupted. And now we'll hear from one of our experts.
Another early sign of Alzheimer's or dementia is subtle changes in behavior. So all of a sudden, the family may notice the person is more easily irritated or more impatient or a little moody or have a shorter fuse or more anxious. Now, there's lots of things that can cause that, but often that can be an early symptom of Alzheimer's or go along with the early symptoms of memory loss.
So I want to do a quick recap before we go on to the next segment. There was a lot that we just went over with these 10 signs. And it's important to remember that this is a guide to help identify problems that may be related to Alzheimer's. It's also important to understand that individuals may experience one or multiple warning signs that we just went over, but it varies significantly. They don't have to experience them all for there to be a concern. If you notice any one of those signs that isn't their standard day-to-day personality or the way they live, then it's important for you to get in touch with your doctor. I know we've gone over a lot of those 10 warning signs. I know everyone is muted, but I wanted to remind everyone to use the chat if you have a specific question to Melissa or I about any of those 10 signs that we've gone over. Okay, Melissa, we can continue. So again, it's the text back and forth to the family, kind of discussing a recap of what I just said. And again, they want to check with their doctor.
Memory is not all or none, especially when there are early symptoms or signs. So on a good day, people might function very well and not really even, no one notices there's a memory problem. But on other days, especially if they're tired, then things become more noticeable. So memory is variable. It's not all or none. And then there are different type of symptoms that develop for each person. So some people may have trouble with language, may have trouble with organizing themselves, may have trouble navigating while driving, and other people don't have the same symptoms. So you don't have to have every symptom of Alzheimer's to be concerned. And I think the most important thing is determining what has changed from that person's normal level of functioning. And usually people have a pretty keen sense of, what they can normally do well. And then when either they or the family notice that there has been some change from that usual pattern of functioning, that should be a warning sign to people, but they don't have to check off all the boxes.
And as I said, I mean, I did the recap before this slide because I think it's very important. We have a large crowd tonight, and I'm sure many of you are already relating to some of these signs. So again, I can't express, if you have any additional questions or concerns, please use the chat and Melissa and I will address your questions. We're going to talk about the importance of early detection. So family and friends are often the first to notice changes. So we're going to hear from one of our experts.
It's a very interesting phenomena that people who have memory problems are often less aware of it than family members or their friends who know them well. One of the reasons for that is our ability to monitor ourselves, which is an important part of brain function, decreases when we start having memory problems. Not in everybody, but commonly, and more than half the people with memory problems. And so the person is just not keeping track of the trouble they're having day to day. But the family members are, paying attention. If they're paying attention, they see, boy, this is starting to happen a lot. And the person's not aware of it. So the family's more aware, and they may talk to their loved one about it. And they say, I've noticed you've been repeating yourself. And they say, I'm not repeating myself. And that could either be due to the fact that they're not aware of it, or they may not want to acknowledge it.
Next, we're going to hear from Mary.
I was so adamant about what was happening to Daryl. I wasn't sure. I didn't know. And this wasn't the person that I know. This wasn't the person. Daryl was my husband was very, he always had to be building or designing or working with his hands. And it was getting to the point where he wasn't, and he was becoming very frustrated when he was forgetting to do things or go places.
So what should you do if you notice changes in someone? So it's the 10 steps to approach memory concerns. You assess the situation. Do they talk, Melissa? I'm sorry.
I don't know that there's videos for each of these, but I think there's something. So just a little statement.
Okay, thank you. So 1 is, what changes in memory, thinking, or behavior do you see when you assess? What else is going on through the assessment phase when you're trying to determine? You learn about the signs and the benefits of early diagnosis. Has anyone else noticed the changes, whether other friends, family members? And then you have a conversation. Who should have the conversation to discuss the concerns that you've noticed? You need to determine what's the best time and place to have this conversation. What will you or the person having the conversation say? Offer to go to the doctor with your loved one. And if needed, have multiple conversations. It doesn't happen with one conversation. It literally will be multiple. And then, of course, reach out for support. Obviously, you turn to the Alzheimer's Association for information and support. and see a doctor. So it's important to understand most people address concerns about a memory loss, thinking, or behavior with their primary care physician. That's fine to a degree. However, in some cases, that primary care physician will refer you to a person to see that's a specialist for further evaluation. That doctor may be a geriatric doctor, a neurologist, neuropsychologist, a psychiatrist, and a psychologist.
There are a number of benefits in early detection of Alzheimer's. For one thing, a person is able to have a voice in what happens next. They can make plans. They can live life more on their own terms. They can also make plans for the future, financial plans, care plans. They can let people know what they want, which can be a real gift later on. It also allows time for families to make plans and to make decisions about who can do what and figure out care and those kinds of issues. Also, the treatments that are available for Alzheimer's don't cure Alzheimer's. They don't slow down the disease, but they do help with symptoms. And it seems as though they tend to work better the earlier a person is able to use those. So that can help too. Some people are interested in clinical trials. Clinical trials allow people to have access to treatments that aren't available yet. And for some people, that can be a really important thing to pursue.
Melissa, before we move forward, we do have one question, and I think it's important to maybe just talk about this in lieu of the end, only because we just went over the 10 warning signs, and this is a great question to ask. Could some of these symptoms be due to depression, is the question.
Absolutely. Sorry, go ahead, Maureen. You were probably going to say that.
No. I'm going to leave it up to you to answer. You're the Alzheimer's representative, but I believe they mimic each other, and that's why it's important to see a doctor and get a true diagnosis. Is this person suffering from depression? Are they on medication for that depression? And just weigh in everything.
Yeah, I completely agree. Yeah, that's a good synopsis of that. It's a lot of these symptoms, withdrawal, changes in mood and personality, just less motivation to do, maybe it's less of like the cognitive issue, the cognitive barrier in terms of doing some of the things you normally would be able to do, but not doing your activities of daily living like you normally would, and keeping up with those sorts of things. There's a lot of overlap. So I'm glad someone brought that up, because older adults especially are incredibly underdiagnosed for depression. And so depression, can be well treated especially between medications and therapy or counseling. That tends to be a really good combination for people. So you definitely don't want to rule it out. And if you think, or the person's physician thinks that there might be some depression, or there has been some depression right along and something else is going on, we need to tease out what could be the depression and what could be something else. And so, yeah, that's a great question. And again, I can't emphasize enough how many people in general, but especially older adults, are not diagnosed accurately for depression as well as memory loss. So,
thank you, Melissa. So I just like to do a recap of the importance of early detection. So it's important to pay attention to any changes in memory, thinking, or behavior that you notice in people. If you see the changes that are unusual for that person, please take action by having just a conversation. Discussing these types of concerns, it's difficult. It's not an easy conversation to have, but you need to consider using the 10 steps to approach memory concerns as a guide. And there's also a number of benefits to early detection, including the opportunity to plan for the future, assess treatments for symptoms, and participate in clinical studies if necessary. Seeking a diagnosis. I'd like to kind of, at the bottom of your screen, you can raise your hand. I'm going to ask a question, and if you think it's true, I'm going to have you raise hands and see how many people may know this question, the answer to this question. So this is a really test of knowledge. The question is, there is currently no way to diagnose Alzheimer's disease. If you think it's true, raise your hand now.
So you tell me what the verdict is, Maureen, because I can't see it looks like a few people raised their hands, so a few people
Yeah,
think
only
it's true.
only four people raised their hands.
So let's assume the
So-
rest of them think it's false.
I'm going to assume the rest think it's false. And it is false. There are a number of assessments and tests that make it possible for healthcare professionals to diagnose Alzheimer's with a high degree of certainty. Is this interactive? Some possible assessments and tests would be your medical history, a physical exam, possibly goes back to the question we just answered. A screen for depression will either rule it out and determine that it's depression versus Alzheimer's. Some tests may include laboratory tests and mental cognitive status tests as well. Brain imaging, it's a PET scan. That's very further down the line, very difficult, unfortunately, to obtain. Right, Melissa, if I'm correct, it is difficult to obtain. So you would want to make sure we do everything else before we really push for that PET scan.
A lot of times it's because of insurance coverage, which is
Correct.
why you got to go through all the other stuff, like you said, Maureen. Yeah, and it's a really expensive test. Let me just, for curiosity's sake, I don't think I've ever. This is really sad to say, but I'm not sure I've clicked on this particular. I didn't realize it was interactive. So for brain, let's just see what that looks like, because I'm just curious. I don't know if that really did anything. So dementia-like symptoms always result in the diagnosis of Alzheimer's or another dementia.
Could have high blood pressure that's out of control, or they might have a thyroid condition that's not regulated, or diabetes that's not right, or on a medication that actually can cause memory loss. Drinking too much alcohol can make memory worse. So there are a lot of factors that go into cognitive difficulty with aging, that some of them can be remedied. And so we want to do everything we can to improve cognitive ability and quality of life.
So just to recap on seeking a diagnosis, the diagnostic experience, it varies from person to person. Something other than Alzheimer's or another dementia could be causing the symptoms, as discussed, depression, high blood pressure. Stigma and misconceptions about the disease, like believing that nothing can be done, can prevent some people from seeking a diagnosis. As we learned throughout the program, there are some medications in the early stages that will help not cure Alzheimer's or dementia, but slow the progression just a little bit or help them be able to continue to function. So this is the text between the family members again. They went through the channels as we've talked about. A true diagnosis has been delivered. And now their doctor has done the right thing. Reach out to the Alzheimer's Association for free resources. So the Alzheimer's Association is the leading voluntary health organization in the Alzheimer's care, support, and research. The mission of the association is to eliminate Alzheimer's disease through the advancement of research, to provide and enhance care and support for all affected, and to reduce the risk of dementia through the promotion of brain health. Ultimately, our world is a vision without Alzheimer's. At the bottom in the left is a very important number. Melissa will share it in the chat later as well. The 1-800 number is available 365 days a year, 24/7. So please, anyone that has a loved one that is going through any of the difficulty that we discussed, this number, program it in your cell phone. And again, 365 days, 24/7. And of course, it's all free. And as I indicated in the beginning of the presentation, I've been a volunteer with the association for the past 10 years because I had a loved one living with the disease and unfortunately has since passed. In my 10 years with the association, I've been in multiple roles, just joining the fight to bring awareness and to just be a support for other friends I've met along the journey. Some of the ways you can get involved is through volunteering, such as I'm doing tonight, teaching this class. I also do advocacy, where I meet with our senators and representatives for the state you choose to live in. I happen to be in New Hampshire, and we advocate for Alzheimer's and whatever we need from a federal and state priority through the government, trial match, and walk to end Alzheimer's. And in New England, I believe there are 12, Melissa, if I'm wrong, 12 walk to end Alzheimer's, where it's just a day to raise funds. All the funds raised go to research, and you walk in memory of a loved one or for a loved one.
Yeah, there's 12 just between New Hampshire and Massachusetts. So there's probably, easily double that between all the New England states. So there's in New England, because we're so close together, there's probably a walk within an hour's drive of anybody, just about. So,
yeah. So Melissa, we do have another question, and I don't know how quickly you can go back to the umbrella, but the question is, does dementia come before Alzheimer's?
Oh, that's a great question. So this is way at the beginning. So let me just go to our umbrella friend. I don't know if I can, I think I can, hold on, oops, no. I think Heather Snyder is the one that shows us if I can, anyway. So which one comes first? What was the question?
Does dementia come before Alzheimer's?
So that's a great question, because we do talk about stages with Alzheimer's disease, which we obviously didn't get to today, but a lot of people do think that dementia comes first and that Alzheimer's comes later, but that's not accurate. And it's also not accurate to say that, Alzheimer's comes first and then comes, later on comes dementia. It's actually that Alzheimer's disease is one of many different types of dementia. So if I can...
More than 100 years.
Fine.
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible
wish I
causes
can't-
of
I don't know
dementia,
that I
and
can
Alzheimer's
pause it.
is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow and the blood vessels in the brain.
Now, let me just pause there for a second. So when we're talking about dementia, it would be, I'm a big fan of analogies and, kind of visual stuff. So I do like the image of the umbrella as being dementia. And this isn't the perfect analogy, but if my Uncle Joe came up to me and said, oh, I went to the doctor and they tested me and I have cancer, I would say, yes, thank you. Thank you, Maureen. There you go. There's a standard picture. I don't know why with all this technology, we don't have a pause button for the video, but anyway. So, if my Uncle Joe said, oh, I was diagnosed with cancer, my follow-up question for him, of course, would be like, I want to know what type of cancer he has. If he's going to tell me, what type of cancer do you have? And he'd tell me, oh, I have, stage 2 lung cancer from all those years I was smoking or whatever. So if someone calls the helpline or talks to me and they say, my loved one was diagnosed with having dementia, automatically 10 out of 10 times, I will say, what type of dementia were they diagnosed with if they were diagnosed with something more specific? And the reason for that is because, dementia causes brain cell death, and it's helpful for me as a healthcare professional, as a licensed social worker, to be able to talk to the person about that specific type of dementia, because all types of dementia cause brain cell death, cause damage in the brain. But what is causing that brain cell death and that damage is different for each type of dementia. So with Alzheimer's disease, lots of people are probably aware of sort of the telltale plaques and tangles that are associated with the brain and that cause neurons to die, which over time, when we're losing more and more and more of those neurons or brain cells, that impacts our overall functioning. Vascular dementia, which it was shown on Maureen's slide when she held it up and on, as part of the video, vascular dementia is a lack of oxygenated blood flow to the brain, which is usually caused from a stroke or a series of mini strokes called TIAs. I've also seen it with people that have had like lifelong really high blood pressure. A couple men that I used to work with, and they just were the type of people, they would just never ever go to the doctors. And by the time they did go to the doctors, the high blood pressure had put so much strain on their blood vessels that they had spent years like not getting quite enough oxygen to the brain. And so there was atrophy in their brain caused from that. But there's a Parkinson's dementia, there's a dementia associated with Huntington's disease, Lewy body disease, which is what they found Robin Williams died of, was Lewy body dementia. So, I guess, I definitely want to clarify that no, dementia doesn't lead to Alzheimer's. However, one thing I do want to share is that there is a newer term that maybe some of you have heard of called mild cognitive impairment. Now that's different. So dementia is that broad overall term to describe different types, different types of conditions causing, cognitive decline significant enough to impact day-to-day functioning. And those were what I was just talking about. But what they found is that there's some kind of functional deficits that are very, very mild, that are between, say, normal functioning and a proper diagnosis of Alzheimer's disease. So somewhere in the middle there, they found, that on clinical testing, sometimes people show up as having just a little bit of a deficit there. And that's what we call mild cognitive impairment. And mild cognitive impairment increases your risk of developing Alzheimer's, but not everybody with mild cognitive impairment develops Alzheimer's. And again, because I'm using like analogies, it would be, again, not the perfect analogy, but if someone has pre-diabetes, not everybody with pre-diabetes, if they're managing, their weight and their blood sugars and they're doing what they can, not everybody with pre-diabetes goes on to develop diabetes, right? So you can think of it in a similar way. So mild cognitive impairment, there are some very subtle changes that maybe even the person's spouse or close family members wouldn't readily recognize. But when they go in for maybe their annual Medicare wellness exam and they do, a mini cognitive, exam on them, there are some subtle changes that show up. And that diagnosis is so that physicians and the patient and family are paying attention to any subtle changes that might happen. But there's someone that I've worked with for several years. She lives up in Lebanon, New Hampshire. She's had mild cognitive impairment now for, I want to say 11 years. And, and so that's a long time, so I think, but that's also because she lives near Dartmouth Hitchcock Medical Center. She goes to support groups. She retired from driving on her own when she was starting to get a little nervous about it. And she has family support nearby. So I think that with the proper supports and everything, that mild cognitive impairment can we can slow things down with that, so that hopefully it doesn't get to the point of Alzheimer's. So sorry to be so long-winded. I hope that answers that question, but it is a really good one because there is a lot of confusion about dementia and Alzheimer's. And I also think that when someone is diagnosed with just dementia, sometimes it's hard for physicians to be able to tease out what type of dementia it is. If someone has a lot of other medical problems, that's why sometimes the physician says, well, I know it's some type of dementia, but maybe they have a pacemaker, so they can't have an MRI or a PET scan, right? And so, they have to work with what they know, with what kinds of tests they can perform on, with somebody. So, but these are great questions. And if people want to discuss their family's, unique circumstances, that's exactly what the helpline is for.
Thank you, Melissa. We have another question. Does the association offer support groups?
That's a great question. I love that. I hardly ever get asked that as part of these programs, but Maureen, the quick and dirty answer for that.
Yes.
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 We absolutely do. And we've actually, to be completely frank, the pandemic actually pushed us to increase the number and the types of support groups that we're offering. In the real sort of middle of the pandemic, we had probably a dozen different types of dementia. I have dementia. Different types of support groups that were both COVID specific and and not. And I just did a 3-part series about for caregivers who are caring for someone in the late stage of the disease. And we've never had a late stage caregiver support group. And there were a handful of people in that program that asked about it. And so I think we're going to be, starting that specific type of group because there are unique challenges in every stage of the disease process and when the disease process ends. As well, for the person you're caring for. So yeah, the question is definitely yes. All of the support groups and of course these programs that we're offering remain virtual at this time, but we will be, our organization is definitely making plans to be opening things up and letting us get back out into the community so we can see people in person again after 15 months.
After that very long-winded answer, to find a support group, though, you can go to alz.org. So Melissa will post that in the chat.
Yes.
And as she said, right now they are virtual support groups, but anything that you're looking for will be there. So she will put that into the chat for you. And again, that's alz.org. We have one more question. What can you suggest to do to keep a healthy memory? Any supplements, certain types of foods, etc.?
What do you have to say about that, Maureen? And then I'll chime in so that I'm not doing all the time.
I don't know. I from my own experience, I think if you eat healthy, you limit your alcohol intake.
Yeah.
You do brain activity such as reading, Sudoku, or crossword puzzles, anything that gets your mind working and retaining knowledge.
Yep. So
just from my own personal perspective, but I'll let you answer from the association.
Yeah, no, you got 50% there. Yeah, there's four things that at least for right now, and the knowledge base is growing all the time. So nutrition is a big one, is a really big one. And you talked, Maureen, about exercising our brain, so stimulating our brain. So that's the second one. Movement and physical activity, another one. And it's actually physical activity has been shown to actually, I'm surprised by this a little bit, has been shown to be the number one most important factor for reducing your risk for Alzheimer's disease. Even more, I'm surprised because I would think that maybe nutrition would be, but physical activity, as we know, is good for our heart. What's good for our heart is good for our brain. And then social engagement. So, I know it's hard to have a party by Zoom, but, even just having, doing what you can socially or from a, socially distanced perspective when you are in person, having those social interactions is really important. And people who are more social, studies have shown that they live longer with a better quality of life. So I think between the four of those and the two specific diets, if you will, or, like nutritional guidelines that we talk about in one of our other programs are the Mediterranean diet, which is obviously high in fish and healthy oils and fats and lots of like veggies and whole grains and things like that. And the, oh my goodness, I think it's the, now I'm going to question myself. Is it the DASH diet? It's a cardiac diet, but it's been shown to also help with brain functioning as well. Yep.
Melissa, we also have, what sort of progress is being made through research?
So that is a great question. So the Alzheimer's Association is kind of waiting with bated breath because there has been a medication called aducanumab. I'll write it in the chat just in case anybody cares. Aducanumab. It's by Biogen, which is a company in Cambridge, Massachusetts. And they have been studying this medication for years. And basically what the medication would do if it ends up coming to market, and it's the closest thing, it's the closest medication to help with Alzheimer's disease since in probably almost 20 years, because I was a pharmacy technician when Namenda came out, and that was like, we thought that was going to be the cure for Alzheimer's, which unfortunately it was not. It's a help, but it's not quite there. But aducanumab is given with as a shot. It's an infusion medication, and it actually dissolves the beta amyloid plaques that are floating around in between brain cells. So before the plaques, that beta amyloid plaque gunk, can adhere and stick to brain cells, the aducanumab would actually dissolve it so that it doesn't get to the point where it's killing brain cells. So that's a new type of medication, and obviously the FDA has been extremely busy approving COVID vaccines and many of other things that are of super high priority. So we're really looking closely at this, and the Alzheimer's Association is working with the Food and Drug Administration to kind of nudge them along and see what the holdup might be. So there are a lot of advances. Yeah.
Yeah, I just looked it up real quickly while you were talking, Melissa. And as of January of this year, the FDA has put the application on, is delayed due to COVID, and they're hoping it will be reviewed in June. So more to come on that through the association. And I'm sure if it is approved, it will definitely make the news.
Yeah. And if you hear of anything, that's another good actual tip, Maureen, sort of subtly mixed in there, is that we hear from people and they, reach out to us and they say, well, did you hear that peroxide cures Alzheimer's? Or, you know, drinking 3 gallons of, you know, coconut oil or whatever. So I just want people to be cautious about the claims that they hear and see on TV, radio, media, whatever. If you have a question or you want to discuss it, just always give us a call or check our website. We've got so much information online that chances are that's going to answer your question. And I have been asked, did you hear they found a cure for Alzheimer's? And I said, this was someone I knew well, and he called me on the phone and I said, Joe, I work for the Alzheimer's Association. Chances are if we find a cure, we'll have been informed about it. But anyway, it was a good conversation that day. So these are great questions. Any more?
There are no more questions, but we have covered a lot tonight. I know
Yeah.
we're coming right 8
Yeah,
o'clock.
we're right here.
So if there are any more questions, please get them in now. And as Charlotte indicated earlier in the presentation, this has been recorded. So I'm sure is your intent to share the link
Yes.
with everyone that
Yeah,
attended tonight?
well, it's been recorded, and yes, I have an email that's going to be going out tomorrow. And if it's not an email, because I know you'd like me to share the flyer, if you wanted to mention the virtual conference.
The conference, yeah, thank you
I'll
so
have-
much. Real quick, the Alzheimer's Association, because we see the everyday needs of caregivers, but also the increased need over, during the pandemic, we are offering a free virtual 2-day conference that begins this Friday and goes until Saturday. I know that is for you all, if you haven't heard about it, is pretty last minute, but we have almost 500 people that have already registered. So please come and join us. We have just a variety of different programs and a special keynote speaker, musical performances, a panel of folks that are living with the disease. So it's a really great opportunity. And if people, are working during the day, then they can always attend Saturday and vice versa. Whatever day ends up working out best for them. We wanted it to be as flexible as possible for working caregivers. So Charlotte, you're going to
Yes, I'm going to be
send that
sending
out for
out an email through Constant Contact tomorrow. They'll have a flyer,
much.
and I think the recording will be up, and we can include the link. If not, you can get to the recording on the Wilmington
on the website, right?
On the website, just click under events, and you'll see recorded events, and this will be under it'll be under YouTube events. But yes,
Thank you.
I plan to
Great.
include it tomorrow. Yes. And I'd like to
Perfect.
thank both of you. I don't know if we have any more questions, but I'd like to thank both
For
of
no
you
more
very much.
questions.
Yes. Well, Melissa and Maureen, thank you for a great presentation. And, we're all hoping that science will catch up with this disease, since there's so many,
Yes.
so many folks affected by people, and then their loved ones. So it,
Their loved ones. Yeah,
extends
absolutely.
out. So many people here around the world.
Thank you very much.
Yes, thank you so much.
Talk-
So good night. Thank you all for joining us. And please check our website for further events. Thank you very much.
Good night. Thank
Bye-bye.
you.